The most common issue that gets raised in our clinic is the problem of redness. People come along and they have varying degrees of redness. They may have rosacea, which manifests as red bumps on the skin, but usually associated with that are broken vessels on the face, or the fact that they experience flushing just with heat, whether it be from having a shower after exercise, and it's socially embarrassing to them. So we're able to address all the issues of rosacea, either with oral medication, but usually in combination with lasers. And the laser setup that we have here enables us to use all the wavelengths that we have to be able to treat the conditions that you've got. One of the unfortunate consequences of rosacea for a very small percentage of people is they get rhinophyma. Now, rhinophyma is usually confined to males, but I've seen it in female patients. And this is where you get an engorged nose, which is very thick, it's disfiguring, it's heavy on your nose, you can have trouble sleeping. But the more important issue is this progresses, and it leads to you want to be isolated from people. The fact is, it's just one of those unfortunate consequences of rosacea, which can be treated very effectively with the laser devices that we have. If you come into me and you say, well, I've got red cheeks, I'm flushing, you're down times 3 days of swelling. We give you an indication of like what we expect the time frame to be for the redness to resolve, and you'll see your final result at the end of 6 weeks. Now with rhinophyma, it's a completely different story. You've got this bulbous tissue on your nose, which we debulk. And then we use the lasers of varying sorts to resurface the skin to give you a much improved nose. So the chances of recurrence are very small, but it is a bit of a journey in terms of recovery. So you need to give you some scope of how long you'll be off work for before you can go back. But the most pleasing aspect of treating a rhinophyma patient is I change that patient's life profile. They feel more confident in themselves. No one's going to ask them questions anymore. And it's pleasing as a dermatologist to be offered such a great service.